One, two, three. Good. Can you hear me? Good afternoon. Okay, good afternoon, everyone. So today we're going to have to do some demonstration on how to self-administer the hydrocortisone injection. So just to take note that every institution or hospitals probably give you different kits. So we do have different types here. But what we will show you different types of syringes. So we do have the normal syringe, which you have to connect the needles, and you also have the safety syringes. I'm not sure if we have the vials, but we will do the practice session on the powder form. Okay. Yeah? So, oh, yes, that's it. Please. So, so when you have the adrenal crisis event, so you probably know already the symptoms. Who, by the way, had an adrenal crisis event and managed to self-administered injections. Okay, cool. All right. So basically, the symptoms to watch out for, the most common ones, which Professor was already explained as well probably earlier, and you can see it on the video, are vomiting, diarrhea, severe weakness, and some patients will also experience severe headaches. So these are all combination usually. But of course, everyone is different. Some patients will just faint all of a sudden, and you just don't know there's no precipitating factor at all. So if you have that time, then it is better to have your kit next to you, which you can see from the Addison's website. They have this nice kits that you can also see outside, all intact in one place. So I have here a 2 ml syringe. Sorry, here's one. So I have a 2 ml syringe. In some centers, they might give you a 5 ml or a 3 ml syringe. And then I have a blue needle, and then I have a green needle. Okay, I'm going to show you how this works. And then I have a water for injection and the powder. So this is 100 milligram of hydrocortisone. So you will prepare that then next to you, and then by then you're already thinking where you're going to inject this. So there's 2 injection sites usually, either on the leg or in the upper arm. So whichever is easier for you. So if you have someone with you, it might be easier for the other person to inject in the arm. But if you're just doing it yourself, then you can inject it in your thigh. If you're wearing some clothing that's a bit thick, so it's easy, it's much better to go into, or you can take it off if it's something private. If you are in a public place, then maybe you can just try and just inject through it because there's no other option. But usually, if you are using this type of needle, this is quite long enough and strong enough to pierce through any clothing. But obviously, if it's something like a thick joggers, then it might be a bit of a challenge. So if you can just maybe go to a private place and then inject it there. Right, so this is what we're going to do. So you prepared everything, okay? And then you open, I would suggest usually to open everything first. Just open that one there. Put it on the side, and then you open as well the needle, just the green needle. Just put it on the side, and then the blue one as well, and then put it on the side. And then you twist open the water, and then you just flip the yellow cap from the vial. Set aside. So now the next step is to connect the needles. So you get a syringe, you will then get the green needle in, okay? So our syringes got green there, so it's easier to remember green to green first. That's what I always say to my patients. But in some centers, you might have different colors of syringes. But we use the green needle to mix up the medication because it's much longer. So you just connect it. You can hear that click. Pull this down and cap it. Then you drop the liquid. So some patients, it's easier to just let it sit there. And then you drop between 1.5 to 2 mils of water. So I'll just say 1.5 is okay. You don't need to get 2 mils because once it's mixed with powder, it will just mix up to almost 2 mils as well. Drill it up, and then you will then put it here, mix it with the powder. So I just leave the syringe there, just sort of like minimize the number of steps that you have to do rather than taking it out and then put it back in. And then you just mix it. It will take about 10 seconds, 5 to 10 seconds. And then once it's all mixed up, then that's the time you have to draw it all in. So just shake it. Okay. Okay. So that's all mixed up. So you can see from the little window there, it's a bit cloudy, but it's all mixed up now. So now you have to draw it all up. So that's one of the main challenges sometimes, drawing it all up. You can draw it all up usually upside down. This is the best way to do it to make sure that that you get everything in. So you can hold the vial with your non-dominant hand, and then you can see here, can you see this brown thing? Yeah, there's a tiny window there. I know you probably can't see it, but you can see it later on here. And then all you need to do is pull the needle down so that the tip of the needle is sitting in that window. Yeah, and then you push the air up, you see, and then that's when you drop all the liquid from there. All right, there we go. You go all in. So now you got all the medication there. You will then close this for safety. Don't use your finger, use the edge of the table. It's locked, and then twist it, put it in the bin. Then you get the blue needle. You will then attach that again. Do that click. And then pull this down. Remove the cap. Hold it at eye level. Then just have to make sure there's no air bubbles. You can flick it. If there's a tiny bubble there, it's fine. Yeah, it won't harm you. And then push the air out so you can see some liquid coming out there. Now you're ready to inject. Okay, so if you want to inject in your thigh, so then it's normally, I'm gonna show this. So where the kneecap is, you can measure it with your hand, like you're dialing a phone, from the kneecap down there, and then this side here. So it doesn't matter either in the top, the side, as long as it goes in the muscle. So you do have muscle here, you do have muscle on the sides, as long as it goes into your body. If it's, oh, sorry. So you do this, like, hello, dial, and then you measure from the kneecap and then down here to in the side. And then you can, that's where your injection site is. If it's in the upper arm, I normally say my patients where you normally get the vaccine, but you can use 4 fingers, yeah? From the top bone there, you can feel the bone of your shoulder, and then you will then measure it there, then down to the last finger, and then that's where the injection site there, just below it, okay? So that's where you inject it. Right, so shall we say I'll give it in my leg. So here, and then hold it like a pen, like a dot, yeah? And then straight down into the muscle, all right? You can stabilize it by your non-dominant hand and then give the medication, okay? Once it's given, you're done. And then you just cap it, okay? And then you've given yourself the emergency hydrocortisone injection, okay? And of course, you have to then seek medical advice, calling 999 or contacting your GP. Yes?
Every reason why you can't just give yourself the injection with the green needle you started with.
So the main reason why we don't do that, because when you've used it already to mix, the needle will become a bit blunt and it might be a bit painful to get, but you can still use it. It's a bigger needle though. Yeah. So that's the main reason why. It's mainly to make sure that you've got the sharpest needle.
Remember to put it slowly.
Yes. So you can give it like 5 to 10 cents when you administer it. Yeah. Yeah. But that's a good question. Yes. Yes. No. You can use that, the blue one straight away. Yes. Yeah, some people have the orange one. Might be a bit smaller though. It's okay. What's important is it goes into the muscle. Yeah, it's blue. Although it's a standard that we give blue as an intramuscular needle, but in some centers they do give orange because it's much. Yes.
Like the old really long, skinny ones, and they're the ones.
There is a smaller orange one that. Yeah, so they're like that. Yeah, so we don't normally really recommend that. Yeah. Yeah. But if that's the only needle you have at that time of emergency, just use it. But if you can acquire a much standard needle, really, that's much better. Yeah. And also with this syringe, sometimes some of the syringes, the needles are a little bit shorter. In some centers, probably gives you a little bit shorter. It's probably half of it. If that's the only thing you have, use it anyway. It still goes into the muscle. It doesn't matter. It might be a bit of a challenge in terms of drawing up the liquid and drawing up the medication. So and mixing. So do you want me to show you how to use this one? Okay. So the only difference with this needle is with this one is obviously you don't need to attach the needles and change the needles and all those things. It's all ready for you. So the preparation is still the same. You have powder, you have the water for injection. If you have the liquid, it's even much better because you don't need to mix them. So it's just the vial, so the ampule and the syringe, and you're ready to go. But I'll show you first the powder. It's easier. So shall we say, so open it up, you'll open it, and then you will then, I'll use another one, sorry. Do you have, oh, there we go, no, it's okay. So you open this one, okay, and then you flip open again. So you take out the syringe, you just uncap the syringe, then you drop the liquid. So this one, you see, it's long, but it's not as long as my green one. So you might have to just tilt a little bit to draw up the liquid. And then you drop the liquid. It's a bit. So about 1.5 as well. So 5. That should be enough. Okay. And then you mix it into powder. Sometimes it's easier to hold it like this, near to the needle, to have a full grip of the syringe. Because sometimes if you're doing it like this, you can also spill the liquid and so it's not much, and you might end up like injecting yourself. Yeah, so safety wise. So you just insert it there. Make sure it's in the middle, by the way, because it might just slide off. It's a bit hard sometimes. And then you then mix it with the water. Don't push it all in. So when you mix it, make sure that it just sits right there. Because if you press it further, the needle might retract. Okay? So when you inject it, just be careful that you just leave a little bit of air gap in there. And then you mix it. Okay? So once it's all mixed up, say yeah, another 5 seconds. Okay? And okay, still a little bit more there. Right. So that's all mixed up. So same thing, hold it at eye level, and then you just pull the needle down a little bit to the window. So this is a little bit hard actually it's got a bit of pressure when you like trying to pull it in and out. So you can see the tip there, and then you just then draw up all the liquid. Okay, so this is the plunger. Just pull the plunger down. Sorry. There we go. So if, for example, you drop lots of air, just push the air back in and then draw up the liquid again until you get all the medication in the syringe. Okay. Right. So you got all the medication there. So you can see there's more bubbles there. So all you need to do is just pull the plunger down a little bit, and then you can flick the bubbles. And then that's all clear there. And then just push the plunger up a little bit. There you can see some water coming out. Oops. Been trying to just. Okay, now you're ready to inject. It's the same thing, same injection sites, yeah, either arm or the leg. So shall we say it's here? Then just inject it there, all in. Then hold it under my hand and just give the medication. Right, so I've given the medication. Check it out. So all you need to do here is just press the plunger. Then you got the needle inside. And then just throw it in shelf bin. All right. All good? So let's do some practice sessions, shall we? So how many are we? 2, 4, 2. So 10 here and then 10 here. So just go wherever. So we got Cynthia, my colleague here, we're gonna. So we can do some practice. You can try on the oranges, and we have the safety needles if you like.